It's story time, guys. Once upon a time, I was a baby social worker who just graduated with her BSW and just starting out on her medical social work career. Today, I'm an LCSW with over 13 years of social work experience in the healthcare field. Being a medical social worker doesn't require a clinical license. So why did I get mine? Stick around and I'll share with you my story on why and how I got my clinical license as a medical social worker. I'll also share with you some insider tips for any of you who are looking at clinical licensure while working in a healthcare setting. One of my first jobs as a newly graduated BSW was working at an Alzheimer's facility as a social services director. I don't really know how I got the job. It was a miracle, but I did. That job was actually really difficult for me at first because it was a lot of end-of-life care, which I didn't have any experience with. And working with families that are dealing with their loved ones and their loss of memory and the grief that they're having to deal with over and over and over again. But over time, I actually became really good at it. I got really good at empathizing and listening and supporting families. And so I developed this dream of becoming a grief therapist. Somehow I went from being afraid of old people, honestly, and afraid of death, to wanting to help people and being a grief therapist. So that was my dream, was to be a grief therapist. I worked in that Alzheimer's facility for 4 years. And during that time, I felt like I needed more education. I felt like I had more learning to do. So I decided to go back to school to get my MSW. And even after getting my MSW, I felt like I didn't have enough experience and I needed more education and more experience before I could start my journey on really becoming a licensed therapist for grief therapy. So I decided to explore other options in the healthcare field to really give me the depth that I felt like I needed to be a really good grief therapist. I worked in an acute hospital setting. I've worked in an LTAC. I've worked in specialty clinics like oncology or renal dialysis. I worked in hospice and palliative care briefly, and I also worked in a skilled nursing facility. And a year after graduating with my MSW, I finally took my clinical licensure exam. And I actually took it in Colorado because that's where I was living at the time. Somehow I passed that clinical license exam, but it wasn't easy. After passing the exam, I had some difficulty finding supervision, and that was due to both because I actually moved to a different state, and so that made things difficult. And then also it was very difficult because in a healthcare setting, it's hard to find that clinical social work because that's typically not where you do clinical work. And different states have different regulations or different kind of guidelines that you have to follow to get your clinical license and to follow the supervision that they are needing for clinical licensure. So once I moved to a different state, I finally was able to find a clinical social worker that was really willing to work with me and work with the agency I was working with at the time, which was an LTAC. And I finally set it up. And I was a month into my supervision and the LTAC closed and I was laid off. So then I was back onto the road of trying to find supervision again. It wasn't until a couple of years later that I was able to get a job at the VA and started my supervision process. And luckily through the VA, it was free. And finally in 2022, I got my clinical license. Yay! Most states require so many hours of clinical experience during your supervision. That clinical experience is supposed to be and include a combination of clinical psychosocial diagnosis, assessment, treatment, individual or group therapy, and client-centered advocacy. There might be a few other ones depending on the state's regulations. So how do you get the opportunity to assess, diagnose, treat, and provide psychotherapy when you're a case manager in a healthcare or hospital setting? Well, I had to get a little creative, and you can too. The thing is, as a social worker, we already do a lot of these things. We're just not thinking about this in a clinical capacity. We're doing a lot of these skills without us even realizing it. So for example, when meeting with patients in a hospital setting, you are always doing assessments. You are completing biopsychosocial assessments to determine treatment needs. You're working with a treatment team to develop a treatment plan, which also includes discharge planning. You're also doing different types of psychotherapy without you realizing it. You're integrating different types of therapy models. You are doing solution focused brief therapy when you are discharge planning, and also helping making sure that they have connection to resources and just kind of troubleshooting what the patient needs to be successful. You're also doing motivational interviewing or motivational enhancement therapy when you're working with people with substance abuse issues. You're going to see that a lot in a hospital setting. You're also going to see that in different acute rehab settings too. You're likely doing narrative therapy and not realizing it when you're working with patients. And you're doing psychoeducation regularly. You are educating the patient about kind of what their treatment goals are, what the treatment plan is. You're educating them on their options. That's psychoeducation. And then you're also probably doing some family therapy, whether you want to or not, or whether you realize you are or not. There are a lot of family dynamics involved when you are doing patient care. So working with your clinical supervisor, you can come up with these ways that you can incorporate these therapies into your work. When you're doing your biopsychosocial assessments on your patients, you can find ways to incorporate diagnostics into your assessments using the DSM-5. So there are actually a lot of ways that you can utilize clinical skills and meet the requirements to get your clinical license when you're working in a healthcare setting. And luckily, that's what I was able to do. I got a great supervisor who was willing to work with me, and we were able to collaborate together to make sure that when I was working with patients, I was meeting all of the criteria. Sometimes I had to do a little bit of extra work with the patient, but that was okay because I was meeting that clinical diagnostic criteria. So if you are interested in getting your clinical license and you're working in a healthcare setting, let me give you a few tips that might be helpful. Before I dive into how you can translate your hospital skills into clinical skills for supervision, please go ahead and like and subscribe to this channel so you can get notified of upcoming videos. Also, make sure to check out the Social Work Mastery newsletter and sign up for that for tips, tricks, and resources on medical social work. The first thing is make sure to find a supervisor who is willing to work with you and has done supervision for social workers in hospital settings or healthcare settings in the past. Next, make sure to check in with your state social work board to make sure that you're meeting requirements for clinical supervision work. For example, in the state of Kansas, they require you to put together a specific training plan with your clinical supervisor, and it has to be approved by the Kansas Behavioral Sciences Regulatory Board first. So make sure to check in with your state's board. Another tip is be willing to spend extra time with your patients, even if you feel like you don't have time. I know that's kind of hard, especially if you are a case manager in a hospital setting and things are very quick. I know that's difficult, but you have to figure out ways to manage that and manage your time more effectively so that you can incorporate those clinical skills. My last tip is to get the DSM-5 pocket guide so that you can keep it with you at work while you're doing your assessments. You can look through that book really quick and see if there's certain things that will meet clinical diagnostics. It is super handy to have. If you're wondering whether or not to get your clinical license as a medical social worker, make sure to check out my video on 3 reasons to get your LCSW as a medical social worker. If you have any questions or feedback, please leave me a comment below. Thanks so much for allowing me to be a part of your social work journey, and I'll see you next time.